Now, let us discuss fee for service. In the Philippines, ICD-10 coding has been implemented through Administrative Order Number 47/2000, which mandates its adoption in all hospitals to improve the quality of morbidity and mortality statistics in licensed hospitals and other health facilities. Also, Philhealth requires all healthcare providers to comply with the ICD-10 requirements for faster and transparent processing of claims reimbursement. An RVU is a number assigned by Philhealth to a surgical procedure to reflect its relative weight or its degree of complexity as compared to another procedure. The more difficult the procedure, the higher its relative value. For example, a simple appendectomy has an RVU of 100, but an appendectomy with associated complications such as rupture and/or abscess has an RVU of 150. Relative value units are used to compute benefit allowances such as professional fees. The higher the RVU, the higher is the benefit allowance. As shown in the tables, an RVU value of 501 and above increases professional fee of healthcare providers, as well as increases operating room benefit. All medical illnesses now coded using ICD-10 are assigned corresponding fixed case types. Based on Philhealth Circular 18-2009, case type is defined as an assessment of the complexity of illness after discharge. The complexity is measured on a 4-scale system, with case type A being the least complex or simple. Example is upper respiratory tract infection. And case type D as the most severe. Example is deep intracerebral hemorrhage. For coding and reimbursement of medical claims, case type will be based on the ICD-10 of the primary illness or main condition. Primary illness is defined as the condition identified at the time of discharge as being the main reason for the patient's confinement. For Table 1, acute pyelonephritis is the primary illness at the time of discharge. Thus, the final case is type B. In Table 2, end-stage renal disease is the primary illness after discharge. Thus, the final case type is A. For surgical procedures and other services, case type is based on the corresponding relative value unit assigned to the procedure. For RVUs 80 and below, the surgical procedure is classified as case type A. RVUs 81 to 200 are classified as case type B. Case type C has a relative value unit of 201 to 500. And case type D has an RVU of 501 and above. For claims with 2 or more surgical procedure, the case type shall be based on the procedure with a higher RVU. In this example, case type B, modified radical mastectomy, is the final case type. In cases where the case type for the medical diagnosis and the surgical procedure are different, the higher case type shall predominate. There are 4 hospital levels. Level 1 or primary hospital has the capacity to do routine laboratories and minor surgeries. Level 2 or secondary hospital can do general surgeries. Examples are the district hospitals of the Department of Health. Included here are the freestanding dialysis centers, ambulatory surgical clinics, and outpatient clinics. Level 3, tertiary hospitals have the major specialties and subspecialties. Level 4, tertiary, are the teaching and training hospitals and have a highly specialized critical care unit. Reclassification of healthcare facilities was done through Circular 14 of 2013 to address inequities in health access. Philhealth strengthened its primary care so that medical illness and procedures that were currently done in a hospital setting can be treated in primary care facilities without compromising quality of care. A fixed professional fee is given based on the healthcare's provider qualification. There are 3 tiers of qualification of doctors. Group 1 for general practitioners, Group 5 and 6 for specialists or fellows, and Group 2, 3, and 4 for doctors undergoing training. For example, a specialist will get a higher compensation of 500 to 700 pesos a day compared to a GP rate of 300 to 500 pesos a day. There is a limit on the compensation of the professional fee based on qualification of doctor. In Philhealth Circular 9 of 2009, payments of professional fees of surgeons are based on the relative value unit multiplied by a peso conversion factor. The peso conversion factor is dependent on doctor category. Group 1 physicians or general practitioner will have a peso conversion factor of 40. Group 5 and 6 have a PCF of 48. And groups 2, 3, and 4 a PCF of 56. Anesthesiologist fee is determined using the percentage from the surgeon's fee. For an example, appendectomy has a relative value unit of 100 with the case type B since the RVU is between 81 to 200. If the surgery was done by a group 2, 3, 4 or specialist, then the professional fee will be 100 times 56 or 5,600 pesos. If appendectomy was done by a physician in training or group 5, 6, then professional fee is calculated to be 4,800 pesos. There is a cap or limit of reimbursement for professional fees depending on the level of the healthcare institution. Maximum payment for physicians in level 1 hospitals is 2,000 pesos per confinement. There is no limit for level 2 hospital. For level 3 and 4 hospitals, there is a ceiling of 3,200 pesos for group 1 physicians handling all case types. For physicians in group 2, 3, and 4 handling case type D with a relative value of 501 and above, the peso conversion factor for computing professional fee is increased to 80. In the example shown, intracranial surgery was done with an RVU of 600. For Group 1 physicians, professional fee reimbursed will only be 3,200 pesos despite actual computation of 24,000, since there is a limit in payment for general practitioners. For Group 5, 6, professional fee is computed using relative value unit multiplied by the peso conversion factor of 48, giving a total of 28,800 pesos. For Group 2, 3, 4, since the procedure done has an RVU greater than 501, then the peso conversion factor of 80 will be used. The next will be an exercise on fee for service. This case is a 46-year-old woman who was admitted for removal of myoma or myomectomy. She was confined in a level 3 hospital for 6 days. A gynecologist and an anesthesiologist, both fellows in their respective societies, were the healthcare providers. Case type of myomectomy is B with a relative value unit of 150. The hospital of confinement is level 3, so the table for level 3 and 4 will be the basis for computing hospitalization benefits. The following are the benefit allowances. For room and board, allowance is 500 per day or 3,000. For drugs and medicines, the maximum benefit allowance is 14,000 pesos. For X-ray, laboratories, and other supplies, the allowance is 10,500 pesos. An operation with a relative value unit of 150 was done, so a benefit allowance for the operating room is 3,500 pesos. For the professional fee of the gynecologist who is in level 2, 3, and 4, the benefit allowance is relative value unit times 56 or 150 times 56, which equals to 8,400 pesos. Professional fee for the anesthesiologist level 2, 3, 4 is computed with the following formula. 56% of surgeon's fee equals to 56% of the product of relative value unit and peso conversion factor of 40. This equals to 56% of the product of 150 times 40. The total is 3,360 pesos. Issuance of Philhealth Circular 31 of 2013 resulted to a change in the payment scheme for providers, with a shift from fee-for-service to case rate payments. Studies have shown that fee-for-service may result to increased expenditure, secondary to prolonged hospital stay, and unnecessary diagnostic and healthcare services, resulting to decreasing financial resources of the corporation. Case rate payments were implemented to support the universal healthcare program of the government, with one fixed benefit rate for every illness. Case rate means a fixed rate or amount will be reimbursed by Philhealth for a specific illness or case, which will include professional fee for a healthcare provider, facility charges, diagnostics and laboratories, medicines, and supplies. With the successful implementation of the first 23 medical and surgical conditions under the case rate payment scheme in September 2011, Philhealth endeavored to implement case rates for all cases and conditions. This promoted an equitable basic benefit that is the same for similar conditions whether admitted in government or private health institutions. ICD-10 is used to code all medical diseases. Modifications were done to address uniqueness of some diseases and conditions in the Philippines. Medical case rates are identified using the ICD-10. Procedure case rates are identified using the relative value scale. Addition of procedures and services were included by Philhealth that are not included in the CPT but were deemed reimbursable in the local setting. Grouped ICD-10 codes usually have the same case rates. The Relative Value Scale of 2010 is a systematic listing of surgical, medical, and diagnostic procedures and services and their corresponding 5-digit code and relative value unit. The description of procedures and the codes used are mostly lifted with permission from the current procedural terminology or CPT of the American Medical Association. As shown, the heading graft for facial nerve paralysis is a common lead term being shared by the 4 modifiers under it. Thus, if referring to the third procedure with code 15842, for example, it should read graft for facial nerve paralysis, free muscle graft by microsurgical technique with an RVU of 260. Similarly, the fourth procedure with code 15845 should read graft for facial nerve paralysis, regional muscle transfer with an RVU of 200. Rates for medical conditions and procedure was set by Philhealth taking into account the following. Number 1, relative claims data from level 2 and 3 government and private hospitals for the immediate past 2 years. Number 2, professional fees for procedures with RVUs taking into account the complexity of the procedure. Number 3, claims data such as average value per claim in tertiary hospitals. And 4, healthcare institution fees for procedures based on average value per claim, computed rates, and expert consultations. For medical case rates, the healthcare institution fee and professional fee is 70 and 30% respectively of the total case rate amount. For procedure case rates, the healthcare institution fee and professional fee is 60 and 40% respectively of the total case rate amount. When the patient has multiple conditions managed during confinement, healthcare provider may claim 2 case rates. The first case rate is medical condition or procedure that used most resources in managing the patient. The second case rate is the medical condition or procedure with the second most resources used. Medical conditions and procedures not included in Annex 3 shall not be reimbursed as a second case rate. For a claim with a combination of case rates, the provider shall be paid the full case rate amount for the first case rate plus 50% of the second case rate. If the second case rate is a medical condition, the healthcare institution will get 20% of the second case rate and the physician will get 30%. If the second case rate is a procedure, the healthcare institution will get 10% of the second case rate and the physician will get 40% of the second case rate. Example A shows a medical condition, subarachnoid hemorrhage, as the first case rate, and a medical condition, acute myocardial infarction, as the second case rate. For the first case rate, the healthcare provider and health facility will be paid 100% of the total case rate for subarachnoid hemorrhage, that amounts to 38,000 pesos. 70% of the case rate for subarachnoid hemorrhage, or 26,600 pesos, will be the hospital fee, and 30% of the case rate, or 11,400 pesos, will be the professional fee. For the second case rate, 50% of the total case rate for myocardial infarction will be reimbursed, that amounts to 9,450 pesos. The hospital will receive 20% of the second case rate, 3,780 pesos, and the health provider will get 30% of the second case rate, amounting to 5,670 pesos. Total benefit is 47,450. Total hospital fee is 30,380 and total professional fee is 17,070 pesos. Example B shows a procedure, simple mastectomy right, as the first case rate and a procedure, simple mastectomy left, as the second case rate. The healthcare provider and health facility will be paid 100% of the total case rate for simple mastectomy right, that amounts to 22,000 pesos. 60% of the case rate for this procedure, or 13,200 pesos, will be the hospital fee, and 40% of the case rate, or 8,800 pesos, will be the professional fee. For the second case rate, 50% of the total case rate for mastectomy simple left will be reimbursed, that amounts to 11,000 pesos. The hospital will receive 10% of the second case rate, and the health provider will get 40% of the second case rate, amounting to 2,200 and 8,800 pesos respectively. The total benefit is 33,000 pesos. Total hospital fee is 15,400 and the total professional fee is 17,600. The following are procedures that should be paid in full even if reported as second case rate. This includes bilateral tubal ligation, blood transfusion, brachytherapy, among others. To trace the history of the use of the relative value scale in the Philippines, one has to review its development in the United States. The relative value scale is a schema used by Medicare in the United States and nearly all HMOs to determine how much money to pay medical providers. In this system, three factors affect calculation of payment. 1. Resource-based relative value scale. 2. Geographic practice cost index. And 3. A fixed monetary conversion factor. This was adopted by Philhealth to compute average costs of surgical operations. This was first formulated in 1972 and has undergone several revisions. The following table shows a comparison of Medicare and Philhealth. Both use ICD-10 and CPT codes, but Philhealth had modifications for medical as well as surgical conditions to address its uniqueness. Both also have relative value unit codes for every procedure. No geographic practice cost index is used in Philhealth. A predetermined conversion factor is used, but Philhealth uses the peso conversion factor, which is dependent on qualification of healthcare provider. In summary, I have discussed the history of Philhealth, its membership categories, and its benefits. Likewise, fee-for-service and case rate payments were discussed. Case studies and examples were given to illustrate these models of payments. Philhealth is a work in progress. It changes depending upon the needs of the population and the political climate present. The strategies for membership enrollment, payment scheme, and benefit coverage continue to evolve. But it is encouraging to realize that Philhealth, despite its limitation, is sincere in addressing the needs of the people. Thank you.